I'd just like to first of all welcome the publication of this bill, and the regulation of health services is obviously essential for patients and also for genuine professionals who spend so much time training and studying to become practitioners. Unfortunately, in most sectors, we've seen cases where regulation has failed, and this has led to negative consequences. However, there are a few other sectors than healthcare where regulatory failures can be devastating and actually is a matter of life or death. The Health Miscellaneous Provisions Bill 2014 represents another step by the Government in further regulating the health services and improving safety, confidence and hopefully medical outcomes. The bill builds upon the Health and Social Care Professionals Act of 2005, which empowers the Health and Social Care Council, or CORU for short, to regulate 12 professional groups. That principal act, it should be recognised, played an important part in defining a health or social care profession by establishing that a health or social care profession is any profession in which a person exercises skill or judgment relating to the preservation or improvement of health, diagnosis, treatment of care of persons with illnesses, resolving through guidance or counselling of psychological conditions, and care activities for any person in need of protection or support. These definitions emphasise how important this area is and how legislative amendments must be thought through and thoroughly drafted. We are gradually moving, perhaps not fast enough, but from a system whereby only 5 professions were regulated, namely doctors, dentists, nurses, opticians and pharmacists, to a system where the vast majority of medical professions will be regulated. And this is necessary for a number of reasons. Firstly, advances in medical treatment and healthcare in recent decades has caused the establishment of or recognition of new professions, of new distinct areas of care, including dietitians, occupational therapists, biochemists, social care workers, speech and language therapists and radiographers. In fact, we can see the continued progression of this trend in this bill in the sections which will divide the category of radiographer into 2, the first being radiographer and the second being radiation therapist. The former is concerned predominantly with the traditional role of diagnostic services in hospital X-ray departments, while the latter is more concerned with the radiation treatment, services for cancer patients, an area of treatment which is thankfully improving and advancing all the time. Secondly, self or voluntary regulation has been the norm in Ireland, and while this type of system might be less expensive, faster to organise or in decision making, but can also have substantial failings in terms of independence, transparency and objectivity. Oversight and scrutiny will be better served by having independent regulation. The current Health and Social Care Council achieves this by getting the balance right on the Council. The Council has 12 representatives, 1 from each of the professions, and 13 representatives not connected to the professions, thereby ensuring a lay majority on the Council. Provision of proper, adequate care and treatment is an integral aim of our healthcare system. However, of equal importance should be the aim of keeping people out of the hospital system by providing enhanced primary care in the community. In that respect, I note that the Association of Optometrists Ireland is welcoming this bill and is describing it as good for eye care in Ireland. The Association has also identified that this bill will facilitate the development of the role of optometrists by enabling them to provide more care at primary level in the community rather than have to make immediate referrals to secondary or tertiary care. And this is an objective which must be facilitated by the Government, by the Department of Health. Another important objective is to be achieved is ensuring that the public has confidence in healthcare and in the professionals administrating that care. It is particularly important considering the vulnerable position where a person with an illness will be in. It is thus encouraging to see the amendments contained in Section 27, 29 and 38 of the bill. Section 27, which amends Section 53 of the Principal Act, promotes the public interest by enabling the Council to cancel registration of a professional in the case of a complaint on the grounds of conviction secured by judge and jury. Similarly, Section 29 of the bill amends Section 60 of the Primary Act, empowers the Council to apply to the High Court to secure an order suspending the registration of a practitioner. However, in accordance with natural justice, the hearing will not be held in public in order to protect the reputations of the practitioner pending the outcome of the investigations. Another section, Section 38, creates a new section in the Primary Act which further strengthens the Council's powers to protect the public through powers to investigate contraventions of the Act by persons other than practitioners. This bill, continues the important role of regulating medical services. It strikes the important balance of ensuring the highest safeguards for the public while providing certainty and reassurance to general practitioners. And I welcome this bill.